today we're delving into a fascinating topic that concerns both physical and mental well-being: beta blockers. These tiny pills have big impact, helping millions of people manage anxiety, stage fright, and even certain heart conditions. Join me as we unravel the science behind beta blockers, explore their diverse application, and share real-life stories of individuals whose lives has been positively transformed by these remarkable medications. So, set back, relax, and let's embark on this insightful journey into the world of beta blockers. So what is beta blockers? Beta blockers are medications that block the effects of stress hormones like adrenaline, helping to lower blood pressure and heart rate. They are often prescribed to treat various conditions such as high blood pressure, heart rhythm disorders, and anxiety. Activation of beta-1 receptors for the heart, cardiac stimulation, kidney, promote renin release, and for activation of beta-2 receptors, liver, stimulation of glycogenolysis, skeletal muscle for contraction, lungs, bronchodilation, uterine relaxation for pregnant, and bladder smooth muscles relaxation. And lastly, the activation of beta-3 receptors causes lipolysis. Beta blockers competitively block the beta-mediated actions of catecholamines and other adrenergic agonists. It is also called beta-adrenergic antagonists, beta blockers, or beta receptor blockers, or sympatholytic agents. First generation, or the non-selective beta-adrenergic blockers. We have here the propranolol, timolol, nadolol, pendolol, and sotalol. First generation beta blockers, also known as non-selective beta blockers, were among the first medications developed to block the effects of adrenaline or epinephrine on the heart. They work by binding the beta receptors in the body, specifically beta-1 receptors in the heart and beta-2 receptors in the lungs and blood vessels. By blocking these receptors, these drugs reduce the effects of stress hormones like adrenaline, leading to various therapeutic effects. The second generation are the beta-selective adrenergic blockers. We have here the atenolol, acebutolol, bisoprolol, esmolol, and metoprolol. The second generation beta blockers like metoprolol and bisoprolol are medications used to treat conditions such as high blood pressure, angina, heart failure, and certain heart rhythm disorders. They work by blocking the effects of adrenaline, slowing the heart rate, and relaxing blood vessels. Unlike their predecessors, these beta blockers are more selective for heart receptors, causing fewer lung-related side effects. They are often prescribed after heart attacks to improve survival rates and can also help prevent migraines in some cases. The third generation, or the beta blockers with additionally vasodilator effect. We have here the labetalol, carvedilol, and celeprolol. Pharmacological actions: cardiovascular system, heart. Beta blockers depress all cardiac properties. It also decreases heart rate or the negative chronotropic effect. It decreases the force of myocardial contractility, negative inotropic effect. It also decreases cardiac output. For the blood vessels, blockade of beta-2 receptors of blood vessels initially may cause rise in peritoneal vascular resistance due to the unopposed alpha-1 actions, but continued will reduce peripheral resistance and reduce blood pressure. And lastly, for the kidneys, it blocks renin release and decreases hypertension. For the respiratory system, blockade of beta-2 receptors in bronchial smooth muscle can produce severe bronchospasm in patients with COPD and asthma. Therefore, beta-2 blockers should be avoided in patients with asthma and COPD. Beta-2 blockers should be avoided in patients with asthma and COPD because this medication can constrict the airways, worsening breathing difficulties in individuals with already narrowed and sensitive airways in these conditions. Selective beta-1 blockers are preferred in such patients as they have fewer adverse effects on the lungs. And for the skeletal muscles, on chronic use, beta blockers may cause skeletal muscle weakness and tiredness due to blockade of beta-2 receptors of the skeletal muscle and blood vessels supplying it. They also reduce stress-induced tremors and also the DOC in hyperthyroidism. And for the metabolic effects, beta blockers inhibit glycogenolysis and delay recovery from hypoglycemia. They also mask the warning signs and symptoms of hypoglycemia. Therefore, beta blockers should be used cautiously in diabetics on hypoglycemic agents. And also, chronic use of non-selective beta blockers decreases high-density lipoprotein cholesterol and low-density lipoprotein cholesterol ratio, which may increase the risk of coronary artery disease. And for pharmacokinetics, propranolol or other beta blockers is highly lipid soluble and is well absorbed from GI tract. However, the bioavailability of propranolol is low because of its extensive first-pass metabolism. It is highly bound to plasma proteins, has large volume of distribution, freely crosses BBB, and metabolites are excreted in urine. And now, let's go with the adverse drug reaction. The CVS, bradycardia, heart block, and may precipitate congestive heart failure in patients with low cardiac receipt. For the respiratory system, blockade of beta-2 receptors in bronchial smooth muscle can cause severe bronchospasm in patients with asthma and COPD. For the CNS, sleep disturbances, hallucinations, fatigue, and mental depressions. Hypoglycemia is common with non-selective agents. For the withdrawal symptoms, abrupt withdrawal of beta blockers after chronic use is dangerous because they can precipitate angina or frank myocardial infarction and even sudden death. And then, muscle weakness, tiredness. And for the drug interactions, we have here the propranolol and verapamil. They produce additive cardiac depressant effects and may cause CCF, bradyarrhythmias, heart block, or even cardiac arrest. The next one is the propranolol and lignocaine. Propranolol reduces the clearance of lignocaine by decreasing hepatic blood flow. And the next one is the insulin and the beta blockers. Non-selective beta blockers inhibit glycogenolysis and delay recovery from hypoglycemia. And the last one is the propranolol and the NSAIDs. NSAIDs, by inhibiting prostaglandin synthesis, promote sodium and water retention on chronic use. Thus, they decrease antihypertensive. For the uses, it is for hypertension, angina, myocardial infarction, CCF, arrhythmia, glaucoma, pheochromocytoma, hyperthyroidism, migraine, and anxiety. Thank you so much for tuning in today's vlog where we delve depth in the topic of beta blockers. I hope you found this information insightful and valuable for your understanding of this medication. Before we part ways, I want you to remind that your health is the most valuable assets, and decisions about medications should always be made in consultation with a qualified healthcare professional. If you have any questions or concerns about beta blockers or any health-related topic, feel free to drop them in the comments below. If you enjoyed this video and found it helpful, please consider giving it a thumbs up and sharing it with your friends and family. Don't forget to subscribe to our channel for more in-depth explorations of various health and wellness subjects. Remember, Knowledge is power, and by staying informed, you're taking an active role in your own well-being. Thank you again, and thank you so much for being part of our community. Take care of yourselves, be kind to one another, and I look forward to sharing more valuable insights with you in our future vlogs. Until next time, stay healthy and stay positive.